The COVID pandemic has put a lot of fiscal pressure on healthcare providers, patients, as well as those who pay for care. As we emerge from the pandemic, it's very important patients get the care they need, but hopefully don't get care that will not make them healthier. So one of the focus of our panel in the upcoming COA PAEA Summit is actually how we might be able to turn the COVID crisis into an opportunity, such that we might be able to implement strategies that will allow us to spend more money on the prevention, monitoring, and treatment of cancer patients and deter the use of those services that do not make those patients any healthier. Obviously, many public and private payers have taken a serious financial hit since the pandemic begun, and they're scrutinizing even more their healthcare spending. I've been worried that there'll be a resurgence of these blunt instruments like high deductibles that prevent patients from getting the care they need as well as the care they don't need. And we're hopeful that we might be able to apply more nuanced payment strategies and benefit designs that will allow my patients and providers to provide the care that we know is evidence-based and will improve patient-centered outcomes, but also put levers in place to make sure that the care that was just provided because we could and didn't make patients any healthier would not return to levels that they were at before the pandemic. Yeah, our editorial, Turning COVID Crisis into Opportunity, can be found online at ajmc.com. So cancer is complicated from the delivery of care, the payment of care, and certainly the navigation of an individual patient. Not only do we have the typical challenges that patients may face, we also have concerns over the increased risk of coronavirus infection and COVID-related diseases, particularly for those patients who are at high risk for not only getting the condition, but actually having a poor outcome. So on top of our usual attempts to spend more money and allow access and affordability to those services that will improve the lives of cancer patients, we have this added element of the coronavirus vaccine that early on has led to significant declines in cancer screenings, cancer diagnoses, cancer treatments, as well as enrollment into cancer trials. So the oncology community has great challenges, but also opportunities to relook at their practices and understand that we're going to be highly scrutinizing what we do, first in terms of patient safety and outcomes, and second in terms of how we're spending our scarce financial resources.